I want to introduce you to Nikki if this is your first time with Nikki. Nikki Kenward's journey began in professional contemporary dance. She expanded into dance therapy and created a dance theater company with adults with learning issues where she was artistic director. Always interested in the body-mind connection and integration, Nikki found craniosacral therapy and discovered the second great passion in her life. Nikki has recently completed an MA in directing physical theater and circus. Her first professional contemporary circus theater show, Epic Minds, was live in London last year. The show was about exploring the surreal and sometimes disturbing world of psychosis. Nikki has recently received an award for this late emerging artist and performer. And you may find that performance by searching the title Epic Minds on YouTube. Nikki has practiced CST for over 20 years, teaching internationally as a certified international healthcare educator for the Upledger Institute International. A pediatric specialist and trauma specialist, Nikki became fascinated with new insights and information on the gut and brain connection and how these might help people with chronic digestive issues. As a result, she wrote her book, It's All in the Gut, Let Your Second Brain Guide You to Optimal Health, and developed her class for the Upledger Institute International, CST, and Listening to the Second Brain. The second edition of Nikki's book is now available, and it's titled Overcoming Chronic Digestive Conditions. So with that, I want to thank Nikki for being here, and I'm going to hand it over.
Great. Thank you so much, Justin, for that lovely introduction. And just to say a very, very warm welcome to everybody who's come to this presentation. I really appreciate you being here, and I hope that you find what we're going to explore with the gut really useful for yourself, your clients, or whoever it might be. So without further ado, I'm going to begin my presentation. So I chose the title of this, Love Your Gut, for a very good reason. And one of the reason really is that so often if we have a chronic digestive issue, it can be very frustrating. It can be, we can almost make an enemy of the gut inside us. It's disheartening, it's debilitating. And we kind of not on side with our gut, we're not working with it. We can very often get into the situation where we are just really fed up with it. So that title is Love Your Gut. And I hope that by the end of the presentation, you will have some more insights and a greater ability to show compassion for yourself and your gut, not just the people that come to you. So here we are, familiar picture. We've all been there. And one of the things I think that has really slowed down this area of understanding is that if you talk about bowel movements, sometimes there's a bit of an awkward silence in the room. And then if you add to that mental health issues and bowel movements in the same sentence, there's even more of an awkward silence. And so I really want to destigmatize this because it's a huge problem, a huge issue. And by keeping it, not talking about it, we're making the whole thing a lot worse. There's just an example. We've all experienced this, haven't we? I had a few butterflies as we were just setting up for this presentation. It's really normal. But of course, we know that ongoing digestive issues can be a lot more than butterflies in the stomach before an exam or an assessment or something like this. They can be, you know, cramps, nausea, lack of absorption of our food. It can be many, many difficult symptoms. So let's work together, all of us, to destigmatize this. Let's try and not judge ourselves and be able to talk about it so that we are not judged. I found this myself talking about my own gut issues, that I have felt judged. And then you feel ashamed, you feel apologetic because somehow you're not better, you're not over it. And that's a very isolating experience. because this presentation is really about emotional stresses, trauma, and the gut. It's not about nutrition. Nutrition is extremely important, but that's not my area, and I'm talking about the other stuff that goes on. So I think the more we can encourage open conversations about this area, the better. And it's so interesting, isn't it? We look at Eastern beliefs and they are completely different. So in the West, we think of the long tube from the mouth to the anus. We think of the gut as really being a tube that the bowel movements go through. The food, bowel movements come out the other end. But actually, of course, in the East, if you look at Tai Chi, Qigong, Buddhism, this part, the lower abdomen, is really considered to be an area of emotional and spiritual growth. So what a paradox, what a dichotomy between these two perceptions that we have. And yet somehow through my journey personally and with my work with the Institute, I really wanting to build a bridge between these two ideas. And I think through the craniosacral work, the emotional work we do with our gut, it truly can be a place of emotional and spiritual growth. And those of you there who are craniosacral therapists, or maybe another kind of body work or manual therapist, will be able to understand this insight and use it in your work. So for a long time, I felt I was really not able to get into the missing piece of the puzzle in my own gut and in the problems that people were coming to me within my practice. I always felt there was a missing piece. I couldn't quite get a handle on it. There was something I couldn't address or reach. My own journey was what stimulated this, really, because I had difficulty in my childhood, trauma, as many of us do, and teenage years. And then to top it off, about 20 years ago, I had a scuba diving accident where I nearly drowned. And that left me with PTSD. But the interesting thing was, although over time I mended my heart and lungs, which were damaged, and I, through a lot of therapy, began to integrate and process that experience, somehow my gut never quite got as far as anything else. It was always a bit problematic. And, you know, I'd wake up in the night and there would be cramps and nausea and palpitations, diarrhea, and this went on and on and on. And whatever I did didn't seem to address it. So that was really one of the main reasons I wanted to do this work. And I have discovered since that almost everybody who comes into my practice with early trauma, past trauma, whether it's war veterans, where it's somebody with a completely different background, they nearly all have gut issues. So that's why I coined my own term, which is post-traumatic gut, because of course PTSD is a diagnosis put together by psychiatrists and psychologists. And so they're not really concerned with other parts of the body, more with the brain and the head and how it works. But in my personal experience, and many of the people that I work with, the gut is nearly always affected. So it's not an official diagnosis, but it's a term that I use to express my perspective on the work, post-traumatic gut. You could add the disorder, but I'm not really keen on the word disorder for post-traumatic stress or post-traumatic gut, because to me, they are a natural human response to events, to life, to challenges, and therefore not really a disorder. So I'll leave that with you for some thought and reflection. So what did I do? I realized there was a missing piece. I realized my gut was, and people that were coming to me were not getting what they needed. So I read and I read and I read, so much research coming out about the second brain, the microbiota, the gut-brain microbiota axis. I studied the anatomy of this complex system and realized that the long tube actually is this incredible universe of complex interactive cells and tissues, which I'm going to introduce you to. I drew on my yoga therapy and meditation practice, and I listened to my gut with my craniosacral hands to see what I could do. So as I said, you know, it's a long tube. Food goes in one end, bowel movements come out the other. It's 9 meters long. There's quite a lot of it. But is that all? Well, no, clearly not. So an incredible man from the States, Professor Emeron Mayer, who I advise you to look up if you don't already know about him, he said this system is way too complicated to just move our food through. He also said in another of his books that the time will soon come when psychiatrists will need to treat the brain, the second brain, the brain in the gut, as well as the brain in the head. And this is a man coming at it from a very traditional psychiatric background. And he's been saying this for a few years now, so I think we can really take notice of that. So what did I discover? What did I learn through all of this? I discovered that the interactive layers found in the walls of the long tube, and especially in the small and large intestine, are an awe-inspiring, beautiful world within us. I discovered that our gut talks to our brain all the time about what we're receiving from the outside world. And there are many, many more messages going from the gut to the brain in the head than from the brain down to the gut. And we all know from our language, don't we, that there's a deeper wisdom there. We talk about gut feeling, trusting your gut instinct. And these messages constantly going from the gut to the brain are part of that. So I learned that we have a really complex modern data processing center in our gastrointestinal tract, often now referred to as the second brain. So the gut is a complex data processing center. And here is just a wonderful image picture to show you that long tube, show you the extent of this second brain. And also maybe to point out that, you know, when you have the brain in the head, it's just in one place in the head. It's a bit easier to kind of get our head and our thoughts around. Whereas the second brain extends down the esophagus, through the stomach, pancreas and liver involved, and then through the small and large intestine. So it's spread out. It doesn't mean it's any less of a brain, but it's spread out over a large area. And here's another wonderful image just to get us excited about this incredible internal world that we have inside, which gives us so much of our felt sense of how we are in that moment. It gives us a lot of our felt sense of how safe we are in that moment or not. And of course, how it reacts will depend on how safe we have felt in the past. So, you know, the emotional gut, that's really how I think of it. And most importantly, what I learned was that much of our deepest and most buried emotional history can be found there. It can be stored, as our history can be anywhere in the body, as we know as craniosacral therapists, body workers, and others. We know it can be stored anywhere, but in the gut, it can be in the layers of fascia, of cells, stored in the enteric nervous system, which may be in an unhelpful default habitual mode. It can be stored in all the layers of muscle and fascia, can be stored in the immune system there, and we'll look at all of that. And it can be a place where we dissociate when we're overwhelmed, perhaps often going into the freeze state, And I'm sure many of you here with me today are familiar with some of these states in the autonomic nervous system. You know, we have fight and flight, we have freeze, we also have the extensions of freeze, which is fawn and flop. I'm not going to go into that in great detail in this presentation, but when we go beyond fight and flight, when we're really overwhelmed, that perhaps is when we dissociate and go into a freeze state. And this often is a place where we go into that freeze state. And some of you who may be familiar with polyvagal theory, for example, will know that the dorsal vagal complex is below the diaphragm in that lower part of the abdomen. And this is the part of our vagus nerve that spikes and takes us into freeze. And I think that this is often why it was so hard for me to get into my own gut stuff and for me to get to my clients, because the stuff there was dissociated from. They'd been in freeze. So it wasn't so easy to get there. And an awful lot of safety and grounded neutral space needed to be created for myself and for the others that I worked with. So here is just a lovely diagram. Some of you might be familiar with these, some of you not at all. Don't try and remember all the words if it's not familiar. That's not why I'm showing this to you. I just want to inspire you with the incredible complexity and beauty of this tube. That's all. So here, imagine this is like a quarter segment of a circle, and the circle is our small intestine with a cross section. And you can see going from the top, the mesentery, that lovely bluey violet color, that's the fascia that surrounds the tube, that supports it, that brings us its nerve supply and its blood supply. And then we're going to get a layer of muscles, which longitudinal muscle, which helps to give the tube its strength to squeeze and contract and move things through. Then we have the first of the big second brain plexuses, the myenteric plexus. That is sandwiched in with the next layer of muscle, the circular muscle, another part of our tube's ability to squeeze stuff through. Below that, we have the submucosa, a dense layer with the second big nerve plexus of the enteric nervous system, the second brain embedded within it. Beneath that, there's another little narrow supportive layer of muscle, the muscularis mucosa. And then we come into this incredible open spongy layer, the lamina propria, which is where an awful lot of our immune system is. We have 70% of our immune system in the gut, and an awful lot of it is here in the lamina propria, which is just jam-packed with lymph vessels, Papaya patches, lots and lots of different cells ready to become active and protect us if some toxins or poison or something comes through the barrier which isn't going to do us any good. And then you can see we have the final layer, which is the delicate single cell layer of the epithelial layer sitting on the basement membrane. The basement membrane is quite fascinating. It's a layer of connective tissue, fascia-like tissue. And I often find in my practice that it often holds significant layers of tension and strain in people who come with diverticulitis, all those kind of ulcerative colitis, those issues. I'm often taken straight to the basement membrane. That also supports and interacts with the epithelial layer, that delicate, beautiful single cell layer, the epithelial layer, which is our barrier between the hole in the middle of the tube, the lumen, and the rest of that system. And the epithelial layer has many different cells in it. The only thing not on this diagram, which we also have, is a layer of mucin or mucus, which is very important, and another layer of protection, because you can imagine this barrier takes quite a lot of battering with the food that we eat and the liquids and everything else that's going on. So isn't that an incredible system? How complex? And that goes through the small and large intestine. The only difference is in the large intestine, we don't have the little villi, the absorption fingers there, which are part of the epithelial layer, because most of our absorption is already done by then in the small intestine. So incredible. And here is just one more image to give you another little image of this system. Here's the enteric nervous system in the small intestine. And you can see the tube has got like layers cut away. On the outside, we have the mesentery and the nerve and the arterial supply coming through that. Then we have the layers of muscle surrounding the plexus layers, the submucosa with the second plexus, Meissner's plexus. Then you can see we have that lamina propria, all that lymphatic tissue, and in the middle, the lumen, which is the hole in the middle of the tube. And all these layers, you know, as in everywhere else in the body, they're not just laid on top of each other. They all support and interact each other. There are conversations going on all the time between all these layers. It's a very, very busy place. And something that I really like is that the hole in the middle is called the lumen, which is interesting because we think of it as dark, but actually, of course, lumen means light. And I quite like to think when I'm working of it being like a light pipe through the body. So then it hit me. This is when it started to make sense. As I started to work on myself, as I started to understand the anatomy and physiology better, really, this tube is the outside world inside. So you can see that anything in the tube is actually still the outside world until such time as anything from the tube is absorbed and crosses into the rest of the body. So this is incredible. This really got me going because I realized that this is where we respond to our life. This is one of the places we respond to our experience, our thoughts, of course, our food, our drink. This is where we react. And how we react is going to depend on our experience through our life and probably before that in the womb. How do we react? What about all those layers we just saw? You know, are there patterns of strain and tension there? What is the default mode in the different parts of the enteric nervous system? All that, of course, will be dictated by our experiences from probably in utero onwards. So how do you react? How do I react? How do the people that we know react? Does a long tube in somebody, does your long tube react in a relaxed and confident way to your daily experience? Is it fearful and guarded, perhaps because of something that happened before? Is it tense and anxious? Is it happy and welcoming for what's happening? Does it go between all of these depending on the context and what that context might resonate with or trigger from the past? So how that tube is, the state it's in, will have a huge impact on how those layers can function or not function, on how well they can function, on all those conversations between the gut bacteria, the neurons, the glial cells, the lymphatic cells, everything. So you can see how our daily thoughts and experience from the past up to now will have a huge impact on that system. Our whole history from birth, and maybe even in the womb, will create potentially patterns of tension and strain, potential dysfunction in the cells and the enteric nervous system, creating unhelpful default settings. So what do I mean by emotional history? I mean, we think about emotional trauma, but it can be a whole range of stressors. Could be emotional and or physical trauma, recently or from childhood. It can be from surgical procedures, even done well, can leave, as you all can imagine or know, an emotional impact, a physical impact on our body, and in some investigative procedures like colonoscopies, you know, quite simple procedures, but they can leave an impact on that system. Of course, infections and disease processes can really impact it. I had this experience myself. Last year, I went to Egypt with my family. I got a parasite. I got really ill, ended up in an Egyptian hospital for 5 days, which wasn't the holiday that I'd planned. But I'm still dealing with the impact of all those antibiotics and the parasites and the trauma of that. And I'm getting there. But, you know, all these things have an impact on us. Chronic ongoing stresses, of course, as we know, has a huge impact. It has an impact on everything, but a massive impact on the gut. So any kind of stress and challenge. Concussion and traumatic brain injury impact the gut, I think within 4 hours of the event that causes it, the gut will be negatively impacted by a concussion or traumatic brain injury. Many of you will be familiar with the ACE study. If you're not, I really recommend you look it up. So ACE stands for Adverse Childhood Experience Study. If you Google ACE study, loads of stuff will come up, and there are some wonderful books that have come out of it. So what it showed, the really big standout feature of the ACE study, which was done in the States with at least 17,000 people, and the research goes on, showed that early years adverse experience has a negative impact that can be lifelong on the gut microbiota. So it showed many things, and if that happened to the gut microbiota, I'm sure it impacts on the other parts of that universe I just shared with you in the gut. It doesn't mean that, you know, if this happens, there's nothing you can do. Obviously, there are mitigating factors. There are things that with this insight and knowledge, we can really improve things. But I think that's really important to know that direct link. So yeah, these early years experiences have the biggest impact lifelong on our mental and physical health above anything else that might happen to us. Another example of the impact of that history on the gut are some cells called IPANs. Now, they're intrinsic primary afferent neurons, which is such a mouthful. I think of them as my pots and pans because it's the way I can remember the IPANs, but they're found in the small intestine. They're intrinsic primary afferent neurons. And this is so fascinating, and this is just one of many things I'm sure we will discover over the next few years as well, is that, for example, I have somebody that I've been treating who has a high-powered, very stressful job. She's very good at it, but it can be a bit overwhelming and challenging. And I think she'd had a particularly difficult week. Friday night, she goes home thinking, phew, thank goodness that week's over. Her husband has cooked a beautiful, nourishing chicken casserole, lovely and wholesome for the family. She eats it and spends all night throwing up and diarrhea. Doesn't happen to anybody else in the family. And this is because when they are sufficiently stressed, these little cells, and I'm sure others as well, receive good food as poison. It doesn't matter what you give them. They're like, no, okay, out. This is toxic. And that's just one set of cells, one thing. So because she couldn't understand what was happening, you know, why? My week's over, I've had this lovely meal, and now look at it, up all night. So that's another really clear example of how the physiology in the gut works and how it can impact us with the stress. Another thing that is impacted by stress in the gut, remember that delicate single cell epithelial layer that is next to the lumen, the hole in the middle of the tube that I showed you. And I said that it's covered in mucus. Well, that mucus is created by incredible little cells dotted along the epithelial layer called goblet cells, and they make the mucus. However, when we're very stressed, the goblet cells aren't able to make as much mucus, and so we get eroded areas where there isn't enough mucus over the epithelial layer to deal with the battering of what happens in our digestive system. And then, of course, any of the bad guys can get their foot in between the tight junctions of the cells in the epithelial layer. The immune system can get activated, and there we are in a state eventually of leaky gut, because we need that mucus. And the goblet cells are another set of cells that are really negatively impacted by stress. So in clinical practice, what do I do? Well, I apply, and for all the craniosacral therapists out there, the techniques I already know to the layers and the tissues. So we know, you know, it's a gentle, hands-on therapy. And even if you haven't done my class with the Institute on the gut, you can still apply those techniques of listening gently, of creating a grounded, neutral space, of taking your time to be really grounded and neutral and create a lot of safety when you're on the gut, on the abdomen. Really, really matters. So any techniques you have, direction of energy, diaphragm techniques, listening, of course, to the significance detector, so important. Listening to the rhythm in the different layers, anything that you already know, and maybe you're a different kind of body worker, you can apply to the gut. I just really encourage you to think deeply about creating safety with your hands for this area because of the high level of dissociation and freeze state that can exist there. I also apply for the up-ledger therapists out there, the somato-emotional release techniques to the layers and the tissues where appropriate. I use visualization and dialoguing techniques to support any of the above where it's helpful. So examples from my clinical practice where I use this work, I see a lot of children and teenagers with anxiety, depression, and sensory integration issues, or some combination of those. And through COVID, and I'm sure it's the same wherever you are, you know, a lot of children and teenagers had to be schooled at home. They didn't have that developmental, social aspect to their lives. Their parents were probably very stressed trying to work and supervise their learning. So I've found a big influx of teenagers, especially young teenagers with anxiety and gut issues, where this has been really helpful. And of course, anyone with a sensory integration issue will have a degree of anxiety, and often there's some gut stuff there. These children may have pain, nausea before going to school or in the night. They may be very constipated, some of them, and relying on laxatives. They may have poor absorption or sensitivity to some foods. So addressing these layers with great compassion and safety in your hands can really help these things. So I do what I do with everyone. I listen to their enteric nervous system and the many layers we've just looked at. I apply my cranial techniques and my emotional techniques. The results have been phenomenal and very, very rewarding. The students who've come to my classes all say they use this work all the time in their practice. And that is great. That was the whole point in creating it, is so it will be used to help. I see adults in my practice with gut issues. Constipation is a big one. Irritable bowel syndrome, the ubiquitous irritable bowel syndrome. And now we know that it is very often preceded by early childhood trauma, which makes sense with the ACE study and everything else we've been talking about. That responds very well. Diverticulitis and ulcerative colitis are frequent visitors. Post-surgery radiotherapy, really, really useful to help those tissues to better functioning. Deal with the stresses as well of going through the surgery and the radiotherapy. I see quite a few adults with concussion. As I said before, concussion and traumatic brain injury impact the gut within 4 hours of the event. I see a lot of people with post-traumatic stress disorder, or as I prefer to call it, post-traumatic gut. I must take the word disorder off this PowerPoint. I don't like it at all. I can give you many examples. I saw recently a rugby player who had several concussions and couldn't work, dizzy a lot of the time, couldn't train, couldn't exercise. We had 2 sessions mostly on the gut, and he is now back playing, back at work. So I really encourage you to have that in your awareness. Post-surgery for brain tumor surgery, really, really helpful, working on the gut. And if somebody's had maybe a traumatic brain injury from many years before, you can still really improve things by working through these layers in the gut as well as the brain in the head. Because we know that we're neuroplastic, the brain in the head, and we know that's true of the nervous system in the gut as well. So I prefer to see everybody as kind of infinite possibilities that can unfold. Let's be open to what might happen and might change. Neurodegenerative diseases, the research is showing that these often begin in the gut, so this work is vital as well, obviously, as good nutrition. So, for example, the Lewy bodies that are found in the brains of people with Alzheimer's are also found now in the gut. And the same with Parkinson's and dementia. So, and it's believed that these issues start in the gut maybe decades before there are symptoms of things happening in the brain and the head. So I want to begin to finish off by saying the enteric nervous system is neuroplastic, just as the brain in the head is. And we know that therefore nervous systems can be influenced and changed by our hands, by our mind, by our thoughts. There is always the possibility of change. We know that the layers of the tube can have their patterns of strain released with craniosacral therapy and somato-emotional release. This gives us hope, very important. The research and the insights I find are really empowering. And the answer lies in our own hands much more than we might be inclined to think. And this hopefully will give us all a possibility of being more compassionate and less judgmental if we have gut issues ourselves, and more hopeful, as well as when we work with other people. Other things that are important to do, as well as CST, breathe. Now, we all breathe, but how do we breathe is the thing. There's some recent research which shows that if the respiratory diaphragm moves in a dysfunctional way, it has a huge impact on the functioning of the gut, which makes sense. So that I found very interesting. And of course, it all goes along with the emotional history, because when we're overwhelmed emotionally or deeply upset or whatever's going on, it very often affects our breathing. Our breathing can become shallow or held or tight in some way. And then even after that event is gone, the breathing doesn't usually come out of that bad habit until we make some effort to improve things. Listen with our hands and heart to your gut. Sit with what comes into your awareness. And if we have time, I'm going to do a guided meditation for everybody here to do just that with me, and I'll talk you through it. All these things are great to make you happy. Whatever makes you happy will help. Singing, humming is wonderful, by the way. Dance, go out in the garden. Find a little time for those things. Take your gut bacteria for a walk outside. Even 30 minutes out in the fresh air walking will really help your gut bacteria, because you'll also pick up a more diverse bacteria just from the environment you're in. So preferably walk in nature somewhere. So let's spend 5 minutes listening to the wonderful layers of our second brain with gentle, compassionate hands, no judgment, no apologies, no shame, and just see how it feels without editing what it feels like. So make yourself really comfortable wherever you are, and just put your hands on the lower abdomen. Close your eyes if that helps you to go inside. Just take a moment to take a couple of deep breaths. Been staring at my PowerPoint on the screen. Relax your face. Relax your shoulders. Allow your hands to be soft and gentle and compassionate to self, to you. And just notice how you feel there. Could be so many things. Maybe you're there with your hands on and thinking, oh, I can't feel anything. It feels numb or nothing. That's just how it is right now. Maybe there's some dissociation there. So just send it your breath, compassion. Everything will happen in its own good time. Don't be frustrated. Don't judge yourself. Don't feel ashamed. Just be there with your safe hands. The body loves being listened to. Being there and listening, even if nothing is showing up, is already helping. You might become aware of some areas feeling tense, some areas feeling more relaxed. You might become aware of some places that feel a bit sore. Sometimes an emotion will pop up or a memory. There is no good or bad. It's all valuable. And this is something that you can do anytime for a minute or 10 minutes. And if you catch yourself feeling frustrated or, fed up with an ongoing gut thing, just say, yeah, that's okay. But now, for this moment, I'm going to send love and compassion to my gut for what it's going through. I'm going to show my gut that I am on side with it, that I'm listening, and we're going to work together, be together to move forward in a more comfortable and enlightened way. So, in your own time, just very gently taking your hands off, come back into your room. Thank you for doing that with me. And I'm just going to leave you with a bit of a more lovely butterfly than the ones that we saw at the beginning. Just with all the words, the listening, reconnecting, balancing, releasing, awareness, all the hope that we have. So I'm going to come back to you and stop the sharing. Thank you again to everybody for spending this time with me for this short presentation. And thank you for the lovely comments in the chat. I've been trying to read them all. I really appreciate it. And yeah, I just hope it's helpful for you and the people that you know.
Wonderful. Thanks again, Nikki. Thanks for everyone for attending. Have a great weekend.
Thanks, Justin.
Of course.